The World Federation of Haemophilia and the Canadian Hemophilia Society are excited to welcome the global bleeding disorders community to the WFH 2022 World Congress in Montreal. This hybrid event is one of the largest for the bleeding disorders community and will be covering the latest medical and multidisciplinary developments in the field, as well as hear from inspirational and insightful speakers from a variety of backgrounds and experiences. This is the WFH Congress Daily Recap. Hello and welcome to the Montreal Convention Centre. It's been 4 years since the global bleeding disorders community has been able to meet in person. So we are so excited for you to join us in person or virtually at the WFH 2022 World Congress. We'll be bringing you some of the highlights from the Congress, including interviews with committee members, national member organizations, as well as visiting institutions from around the world achieving innovative work in the field. On today's show, we get highlights of the medical program with Professor Johnny Mahlangu. We'll take a look at Indiana University's Herman B. Wells Center and HemNet in the United Kingdom. We catch up with Dr Catherine Lambert to talk about the World Bleeding Disorders Registry. And we'll hear from this year's Susan Skinner Scholarship recipients. First, though, it's time for a warm welcome to the meeting from Dr. Kate Kerr and plenary speaker, Professor Mark Kay.
Welcome to WFH 2022. 4 years since we last saw you in Glasgow. I'm delighted that you're able to be here either physically or virtually on what is going to be a great meeting, great venue and fabulous weather.
This meeting's for anyone who's involved at any level in bleeding disorders, from the individuals who have the disorder to all the different groups of individuals who are involved in the treatment of patients with a bleeding disorder, as well as the research community trying to develop new therapies, both from academia as well as from the commercial side.
So it's great to be in Montreal. This is of course the home of WFH, but also of McGill, where we all know lots of fantastic research happens, including the WAPS programme looking at pharmacokinetics in haemophilia. And for nurses this year it's been virtual and I've seen some good presentations being given. I've also heard some of the psychosocial and I'm looking forward to actually seeing more of the evidence being presented face to face as well as virtually as we move forward. I think you would expect there to be lots about gene therapy, but I think there's also some exciting things coming around women and bleeding disorders and managing pain, which we can put a man on the moon, we can do gene therapy, but we still can't make you pain-free. It's important that we think about that too.
I'm particularly interested in some of the new gene therapeutic approaches that are underway and how that ultimately can affect the treatment of patients with bleeding disorders moving into the next decade. I will give a brief overview of the history of gene therapy for hemophilia. I'm going to discuss where we are today, what the current limitations are in gene-based therapeutics for hemophilia, and where we need to go to hopefully one day have a cure using a gene-based therapeutic approach.
Wherever you are in the world, whether you're watching virtually or whether you're actually here, I hope you have a great week learning lots of science, and if you're here, have a great time socialising with all of your peers too.
I'm now joined by WFH Medical Program Committee member, Professor Johnny Mahlangu. Thank you so much for sitting down with me today. How's it going?
Great,
Yeah?
Very exciting times.
Well, I'm glad you stopped by to chat with us because you're going to give us sort of an overview of what we're going to see at this event. So what can people find at this year's meeting?
The program is along certain principles, and the most important principle is that it is comprehensive. It covers the whole spectrum of bleeding disorders. Secondly, it caters for a diversity of attendees. As you know, this meeting is very unique. It is attended by people with bleeding disorders and their caregivers, the healthcare providers, and our industry partners. And then the third part is it actually brings us up to speed with the therapeutic interventions that one would like to see progressing in the field.
What are some of the exciting sessions happening at the medical program?
I think the most exciting ones for me are the ones that going to bring us up to speed with the most recent therapeutic interventions. We're talking here about several sessions on gene therapy. There will be sessions that specifically look at comorbid conditions, and of course we are not going to ignore the variety of bleeding disorders that one is looking after, anything from hemophilia to van Willebrand's to platelet disorder to women's bleeding disorders, etc.
Wow, lots of different issues being discussed. Yeah. And it's certainly a wide range of people attending the event, like you mentioned. What are some exciting sessions that young clinicians look forward to?
I think young clinicians would be particularly excited about the therapeutic interventions, the novel therapeutic interventions. Most young clinicians would come from a multidisciplinary environment, so they'll find interest in cardiovascular conditions, in mental conditions, and a whole host of other conditions that they would be familiar with, as opposed to just diving into the bleeding disorders only.
And what about you? What are some highlights for the meeting?
Well, the most important highlight was, of course, meeting my colleagues after a pause of 2 years. And perhaps I'm looking forward to the sessions on the updates on the advances in therapeutic interventions. As I mentioned, gene therapy is one of them. We are also looking into non-replacement therapies. We're specifically reviewing some of the phase 3 data. We are particularly excited about the low-dose prophylaxis, which is espoused in the WFH management guideline as probably one of the options, particularly for resource-constrained environments. So these are some of the sessions that I would be particularly interested in.
Well, I hope you have a really enjoyable next few days. Professor Mahlangu, thank you so much for sitting down with us.
Absolute pleasure.
All the best. The WFH Congress Daily Recap features highlights and interviews from this year's WFH World Congress in Montreal. You can find us around the Convention Center, on the WFH Congress platform, and online. There's plenty more to come, so make sure you keep watching. Coming up, we get insights into the World Bleeding Disorders Registry and the Susan Skinner Scholarship Program. But in the first of our visits to organizations around the world, the Gene and Cell Therapy Program at Indiana University's Herman B. Wells Center is working across disciplines to develop effective bleeding disorder treatments. Let's see how the program came about and find out how they're uniquely poised to help hemophilia patients.
The mission of the Gene and Cell Therapy Program at the Herman B. Wells Center for Pediatric Research is to provide the basic science and technology development for more efficacious, less immunogenic, and safer gene therapies for hemophilia and other genetic disorders.
In our laboratory, we harness the incredible suppressive capacity of Tregs by a process called receptor engineering. My collaborations with diverse interdisciplinary areas, such as bioengineering, has resulted in important impacts to my research.
This lab has a great legacy. Roland's work 20 years ago basically laid a foundation for the first clinical trials in gene therapy. And since then, we've learned a lot, and this lab still remains at the very forefront of that progress.
And now from the UK, HemNet harnesses a global network of nurses and allied health professionals across the bleeding disorders community to better understand patient and family experience. A key objective is to empower healthcare professionals through knowledge sharing and bespoke training to bring about positive change in clinical practice. So let's take a look.
I would want an entirely different experience from my consultation.
The benefit of this is that patients are sharing their stories with other patients.
HemNet is a specialist research, communications and education consultancy working in the bleeding disorders community. Our aim is to engage, to communicate and empower.
We combine quantitative techniques like surveys with detailed interviews. We've used this mixed methods approach in many studies, which is essential to understand people's real-life experience.
we think it's important to communicate study results to the widest possible audience. We turned some of the real-life stories we'd heard into powerful animations.
It all comes down to really understanding patients' lives, communicating that understanding in ways that resonate with different audiences, and using it to empower professionals to bring about positive change in clinical practice.
Joining me now is Dr. Catherine Lambert. Thanks so much for sitting down with me today.
Thank you, Gina.
So you're here to chat about the registry. So set it up for us. What is it all about?
So the WBDR is the first and unique global registry collecting data and standardized data on people with hemophilia. Actually, there are approximately 10,000 people who are registered, and in the future there will also other bleeding disorders that will be included, such as von Willebrand disease.
And how important is it to have all these bleeding disorders together in one place?
So it's really important because it provides real-world data and also data on quality of life among the hemophilia community.
Absolutely. So what is it like being here, speaking to attendees, socializing with everybody, going to events? What has it been like so far for you?
It's doing well, so very exciting program, and we learn a lot, and I hope that we can share a lot about the WBDR during this meeting and increase the number of centers that will participate to the global registry.
And who can participate in the WBDR?
So it's quite easy, so any HTC can participate after the approval of the local ethics committee, of course, and after a training about using the platform. The platform exists only in English, but in the future months it will be also available in French, Russian and Spanish. And this is really of importance that it will increase the use and the availability for the Hemophilia Treatment Center to use this platform in their own language. But also importantly, it will make a more equitable and available access for all the members of the hemophilia community around the world.
Everything is so global now, right? Everybody is so connected.
Exactly, and it's really important because it's a global disease, and we know that there are main discrepancies around the world for the management and the screening of hemophilia. So having this registry will also help us to focus on places where there is more attention needed.
That's great. Thank you so much for sitting down with me today.
Yeah,
Anything you're specifically excited about in the next few days?
I'm really excited to learn more about gene therapy, of course, but also all the developments in the community and all this networking. Finally, we are together and we can share personally all the experience.
And together in real life.
Exactly, yeah.
Dr. Catherine Lambert, thank you so much.
Thank you, Gina.
Enjoy your day. The Susan Skinner Memorial Fund Scholarships are awarded every 2 years to U.S. and international recipients and cover their participation in major WFH events. The goal of the scholarship is to promote the engagement of women and girls in the global bleeding disorders community by providing opportunities for education, training, and networking. Let's find out what some of the recipients are up to here at the Congress.
To carry the voice of women and girls. It's really my first wish when I came to this scholarship, because I think we have to be their voice and to say everywhere, women bleed too, and women need early diagnosis for them.
They have a voice, and we have a voice that needs to be heard. We are often forgotten, but this experience is really showing us that we are important, and we have also a mission to carry when it comes to fighting for a better care and better treatment for women in a bleeding disorder. So if women are thinking of applying to the Susan Skinner Scholarship, I would say go for it. Go for it. That's what I would say. It's a great experience. Just the sisterhood that we have, and sharing different experiences is really the most rewarding part of it. So yeah, go for it.
We are sharing experience, and I think we are more self-confident to create things in our NMO, to share our experience.
I think girls should totally apply to the Susan Skinner Memorial Fund Scholarship. I like how they've expanded the age as well, so like now older women can apply as well. It's a really great opportunity. I'm really excited to meet up with my friends at the Hemophilia camp in Michigan and talk all about this conference and maybe encourage them to apply as well.
If people are thinking of applying to the scholarship, I would say, what are you waiting for? And just do it. It's a really unique opportunity. Like I said, I've never met so many people from around the world, and our role is sort of to observe, which I also think is a sort of unique viewpoint that we get to have. So I would say go ahead. This is the nudge that you need, probably.
It's just a really special opportunity, and I would love to, you know, like talk to some girl in the future who's also gone here, and maybe we can like discuss ways to, you know, improve like the future experiences of other girls.
We really have joined a great alumni network of people that have also received a scholarship before us. So I think just seeing that sort of force keep strengthening, and if we can build a network of women that are all advocating for the same thing, I think we'll all be better off because of it.
I will say it's your turn now. Don't miss that experience. It's your turn to become the next leader in your NMO, and it's time to have more and more women as leaders.
Apply to be the next Susan Skinner Scholarship recipient today.
Postulez pour devenir la prochaine bénéficiaire de la bourse d'études Susan Skinner aujourd'hui.
Apply to be the next Susan Skinner Scholarship recipient today.
Yeah, that's some sisterly.
Well, congratulations to the recipients, and we really hope they enjoy the rest of their week. That's it from us at our first show at the WFH World Congress 2022, but make sure to come back tomorrow to find out how national member organizations are improving care and treatment for patients worldwide. You'll also see a discussion on the annual Global Survey and Gene Therapy Registry, and we'll look at more organizations advancing research in the field. Until then, find us here at the Montreal Convention Center on the virtual platform and online. We'll see you tomorrow.